National Durban 90.4 FM, Peter Maritzburg 105.6 FM, and welcome back. It is 11:14 at the moment. It is time for us to, before I actually start today's show, we'd like to take the time to properly introduce our very special guest to our wonderful listeners in order to appreciate and respect his advice. Our show, Urban Women, is proud to welcome South Africa's pioneer of non-invasive healthcare, Dr. Rakesh Muhanlall, on air today, who is a world-renowned doctor of clinical technology who has helped hundreds of patients to recover from illnesses even when all else failed. For those who have not been fortunate enough to listen to him before, Dr. Muhanlall is a leader in healthcare who is regularly invited to as a guest speaker to most radio stations. He has been featured in documentaries in many other countries and treats patients as well as medical professionals both nationally and internationally on a daily basis. He holds the world's first Doctor of Clinical Technology degree, specializing in cardiovascular perfusion, and now practices technology-based non-invasive integrated medicine. Dr. Muhanlall leads the way in non-invasive healthcare technologies such as full-body biofeedback testing, cardiac three-dimensional vasculographic scanning, and external counterpulsation treatments. And he's going to be chatting with us. He has more than 28 years of experience in the medical field, and today he uses the training and expertise he gained to improve the health and well-being of South African people, from toddlers to the great-grandparents at the Heart and Healthcare Centre in Durban North. Good morning, Doctor. It's such a pleasure to have you on Urban Women today.
Hi, good morning. Thank you for having me here, and good morning to the listeners as well.
I think it's so important that we understand the healthcare practices that are actually available to us. So share with us, Dr. Muhanlall. Please enlighten our women listeners how they can benefit at the Heart and Healthcare Centre.
Well, being a mother is no easy task. We've all had mothers, and there's a lot of burden that's placed on them, as you have to take care of everybody else and look after yourself last. So regular testing and treatments that we offer non-invasively would be able to detect any illnesses that the mother or the child has, and we'll be able to treat them well so that they will be able to continue performing their tasks and also keeping a good relationship. The modalities that we offer at the Heart and Healthcare Centre in Durban North is a full body biofeedback screening test, which can scan you from head to toe, basically. And it looks at the patient's neural network to see what sort of illnesses the patient has. So this test can be done for the children as well as the parents. The second modality that we have is known as three-dimensional vasculography. In layman's terms, it's a cardiovascular test. So it checks on your heart, it measures blood flow in your heart, it measures the power of the heart muscle, if there's fluid retention in the lungs, air retention in the lungs, as well as we check on the kidney function and the risk profile of people. People want to know early if they are at high risk of strokes or heart attacks. The next modality is a cardiac echo, which is a conventional modality that we look at the internal organs of the body or the heart itself, and we can look at congenital defects, whether the patient or the child has a hole in the heart, or whether the parent has valve defects, or if the heart is not performing as well. Then we have a treatment modality which is also non-invasive, which is called external counterpulsation. This treatment is very, very effective. It's a lifesaver, literally, and it's known as the natural heart bypass. So external counterpulsations can be used to treat heart attacks, can be used to treat heart failure, strokes, Parkinson's disease, and chronic fatigue syndrome. It can also be used by athletes, obviously, to improve their performance. So this is a very important treatment, as it's one of the only treatment in the world that can be done while you're literally having a heart attack or a stroke.
Absolutely amazing and fascinating, because my mom just had a quadruple heart bypass, and hearing what you have to say, it's so amazing if people can actually have your therapy, rather, because it's non-invasive, as you have explained, and the healing process after an open heart surgery is really not pleasant. So it's so great to have this information being shared with us today on Urban Women, and you've explained how important mothers are. We are definitely the pillars, and it's so pivotal, a pivotal role that we play. So important for us to stay healthy. Now, you mentioned biofeedback. That sounds very AI and futuristic, Doctor. Please explain to us how that works.
Well, biofeedback is AI technology. It's the future of screening and diagnostics in the world. The technology uses your own neural network, which is your nerves in your body, and sends signals from your brain to every part of the body. This in turn allows the healthcare professional to absorb all the information that the machine then gives us, and this would be able to help us to treat you and see which parts of the body are not working appropriately. We can either treat you or we can refer you to another specialist should it be required. The biofeedback test covers all systems and organs of the body from head to toe, literally. We can screen every organ to identify which is not functioning optimally, and we can identify the actual cause of the problem. So we can recommend the correct treatment and medication if required. Being mothers, as I say, they work very hard, they prepare meals, they foster routine in our kids as best as they can. How do they know if what they are doing is correct? How do you know if the food you've given your child is correct? Is there any way you're testing it? Is there any way to see whether your child needs to detox or not? I mean, there's a lot our forefathers did that we don't do today. And the foods obviously is not as good quality as we did. Simple things like we talk about processed meat, but we don't understand what does this really mean. Processed meat is bad for you. What is it bad for? Your cholesterol is a good thing. It's never been a bad thing. Cholesterol is what's needed by the body. Most of the brain is made up of cholesterol. We've demonized it, unfortunately, to make money from medication. But cholesterol is a very necessary part of the body. Now, how do you know if what your child is eating is good or not? Now, the bad part about processed food is that, for example, in order to make a polony or a sausage or something like that, we need to mix animals' meat from a few cows or sheep or whatever it is. It's not taken from one animal. When we do this, we mix the bacteria of different animals into one product. These bacteria may interact and cause a big problem in baby or a child or yourself. So we're not aware of this because remember that we obviously seeing the end product. We're not seeing what goes into it. For example, I mean, there was a study done that found one side of a road in America had so much of problems with thyroid problems and autoimmune disorders, and the other side didn't. And the only difference was that a butchery that was sold actually started mixing the thyroid gland into the sausages where they were making it, and that actually the hormones then transferred to the females especially, and they had a lot of problems after that. So these are the things that we're not taking into consideration. So how do you know what's happening to your child? A lot of things today have parasites, they have worms, they have microbacteria. They have a helmet, which is microscopic worms that actually enter the body. I know it's a hard thing to talk about, but this is things that you're consuming every day that you're not aware of. In most people, your body would get rid of it. But in many people, your body cannot get rid of it. And these tests, like the biofeedback test, can then establish whether your body got rid of it or not. It'll actually show you what went through your body, literally, and when you got rid of it, how long ago, and what is still there. And these things actually cause health. I mean, we've heard that, for example, sushi has a problem. Your raw fish, you'll get worms from it. I mean, we thought was hearsay. Now, when we test patients who eat this all the time, we actually find that they have parasitic infestation, as well as different types of worms and helminths that get into the body. So now we can actually establish what's happening to you at an early stage so that we stop it at that stage. Because once they pass the blood-brain barrier and get into the brain, it's actually very difficult to treat these patients. So that is why conventional tests, unfortunately, cannot identify these things. If you had to go to a normal practitioner, there is no ways he's empowered to do it. And again, we are not better than anybody. We're just exposed to more technologies and we have embraced it. There's only one constant in life, and that is change. And when you accept change, then you obviously keep with the times, literally. So you want to know what's best for your family, then you'll have to, unfortunately or fortunately, look at these types of technologies to show you what nobody else can. And this is what biofeedback can do for you. It is absolutely safe, painless, accurate, and cost-effective as compared to anything else on the market today.
Now, you're making my mind wander in all directions because I'm thinking, I love sushi. I had sushi not too long ago. And what if I have to come through? What you may find is absolutely scary and what you've just explained. But on the flip side, I'm also so grateful that my daughter says, Mommy, I don't want anything processed now. So that's great. But doctor, you know what? The full body biofeedback test sounds amazing. Please tell us more of what the test checks on.
Well, for the parents and the kids, I often say kids because it is something that we should do for all our children. And as a mother, your main focus in life is your family. So to take care of them while you take care of yourself, you should identify what vitamins they require, what is short, what minerals, what electrolytes, what amino acids that they need and they may be lacking. How would you know? I mean, buying a multivitamin would not make sense if they're only lacking one vitamin. The rest is just wasted from the body. It checks on decreased blood supply to your brain, to tissue and nerves. It checks on the blood circulation throughout the body. So we can see if there's illnesses or weakness in any part of the body, whether this is coming from insufficient blood supply, oxygen, maybe lactic acid that's sitting there. It look at the heart muscle, the valves of the heart. So we can actually establish if the coronaries are functioning properly or not. It looks at the lungs, which is very important in most people, especially after COVID. So we see emphysema in patients, sinus problems, allergies, rhinitis, sinusitis. All these disorders that can actually be picked up in the machine, and it'll tell you how long it's been in the child and affecting the child. It look at the entire lymphatic system, which is your drainage system for waste in the body, the
Right.
liver, the gallbladder, the pancreas. It'll diagnose if the liver is functioning optimally, whether you have fatty liver disease, which is very common today, because in the past we used to detox the liver, but today we don't. And this is obviously impacted negatively on us. It'll identify osteoporosis in the skeleton of the body, which is very important for females. It'll look at anemia, the cause of anemia, because today it's very, very common in females. And you'll be
Yes.
surprised how much of illnesses stem from just anemia. And there are different types of anemia. So we can establish whether it's hypochromic anemia, iron deficient anemia, vitamin D deficiency. So we can establish which anemia you're actually suffering from and target that area. It also provides excellent details on the gut. The digestive system, is your second brain, as I always say. And if
Yep.
we don't have an optimally functioning digestive system, then everything doesn't work in the body. So this can
Right.
establish whether the good bacteria is sufficient in the body or whether the patient has intestinal dysbacteriosis, whether there is any sort of ulcers, gastritis, erosive gastritis, polyps in the duodenum, polyps in the entire gastrointestinal tract. So it can check all this also, as I said before. It look at bacteria that's there. It look at excuse me, it look at worms in the stomach. It'll look at parasites in your system. So especially in females, we can also check the urinary tract. Well, it checks it on males and females. So with the males, what's more common obviously is prostate problems, and with the and parasite infestation. And what's common in females today, what we're seeing is urinary tract infection. Now, urinary tract infection can be treated very easily if you know what you're doing, but conventional medicine unfortunately cannot treat it because you use an antibiotic to treat problem with the urinary tract, which is caused by bacteria. But then when you
Yep.
use the antibiotic, it kills the probiotics, which actually are your police to ensure that the bad bacteria doesn't increase. And we see this
Correct.
very often, and the solution is actually very simple because we can establish which type of bacteria, whether it's bacteria lactis or whether it's parasite, whether it's trichomonas, we can identify which sort of bacteria or parasite is in the urinary tract system and which part of the urinary tract is affected, and we'll be able to treat the mother or daughter very easily for this. We can measure the pH levels, so we look at obviously acidity, and we can bring down the acidity if there's a problem. It also checks on blood flow to the brain, every part of your body literally. So if you're getting headaches, often it'll be able to establish where it's coming from. Patients have this cold sensation on the legs, pins and needles, numbness, all these things we'll be able to establish where it's coming from and treat it accordingly. The machine is capable of doing so much more than this. Unfortunately, even it can even check your chromosomes to see what's not functioning optimally. But I think that's enough for for one day for our patients for now, or our listeners for now.
Indeed. So, I think the things that you've mentioned speak to many of us listening right now. And I have to say that this is very comprehensive. Do you then, doctor, treat any of these ailments that the test picks up?
Well, I'm trained in both allopathic pharmaceutical medicine and I'm trained in natural medication. So we do not choose sides because we have the patient's interest at heart. So we'll be able to treat the patients allopathically if required, or using natural medications, which we have fantastic results with. And most of the patients from even Ellen Sar will attest to this, that we have fantastic results with them. The common problem that we face today with children is stomach problems, as we just mentioned, acne, weight gain. Sinuses and allergies cause health in children because one would think there's just a simple problem with the nasal passage, but the
Mm-hmm.
oxygen extraction becomes poor in the patient. And because of that, your child may be sitting in school, they cannot breathe properly, cannot extract sufficient oxygen, so there's not enough oxygen to the brain of the patient. So your child may not be functioning optimally, and yet you may think that the results is not as good as you want, or you may think that he can perform better, but you don't understand the reasoning behind it. Whereas our
Mm-hmm.
machine can actually look at these things, identify what's wrong with the child, and then we can put systems in place to treat this very easily. Remember, simple things like a rash, eczema is very common today. And then conventional treatment is steroids. Now, once you start the use of steroids in your child, that is like the beginning of the end of problems. You know, You'll be surprised at what happens when you use steroids. And when it flares up the second time, it literally comes back with a vengeance. So steroids are not
Wow.
the solution for things like this. We can actually treat the child, find out whether the area that the patient is having a problem with or adult is coming from an autoimmune disorder or whether it's coming from a fungal infection. We can pick up if the fungal infection is there, what's the name of the fungus that's attacking that area, and we'll be able to treat it very easily. I did a scan with somebody recently, and I was saying to the patient, okay, it's picking up that you got a fungal infection in your skin. And he says, no, that's not possible. I don't have one. And I said, no, let me check it again. And we looked at it. It was a fungal infection on his back. And his wife started to laugh. And I asked, why are you laughing? She said, just last week he's showing me there's a black spot on his back and he doesn't understand why it's there. So this will tell you the degree of accuracy of this machine. So remember that you
Well,
want to check and see that we can treat your child at early age to ensure that we're able to control the disease progression in the child. And simple thing like detoxing a child, we'll be able to do this safely to ensure that the child gets rid of all the toxins from the body so that their liver work properly, their spleen work properly, their skin is optimal. Then when it comes to the mother, obviously, the problem with women, no offense, is that they are born with 1/3 the pain receptors as men. So because you
mhm,
are born with 1/3 the pain receptors as men,
mhm.
you obviously don't feel the pain men do. I know you thought that men are weaker than women, but,
We did indeed.
but this is just because we have more pain receptors than you do. So why
Uh-huh.
is this so? This was done by nature to ensure that the lady can manage during delivery, during childbirth. If
Mhm.
she felt the same pain as men, it would be very difficult to deliver naturally. So
Yeah, that
God or nature has made it like that so you can survive. But the problem
absolutely.
is that when a patient gets old, when you do get old, now you don't feel the pain that men do. So this is masking all your symptoms. So ladies would identify their problems not with pain first, with inability to perform and achieve certain tasks. So for example, a lady might say, hey, when I was younger, I could get the kids ready, clean the house, do my work, and wash the clothes and dishes and do all the stuff and never get tired. But today,
Mhm.
after each chore, I have to rest and then start again. These are signs that's telling you that your body is not working optimally. Unfortunately,
Absolutely.
you may not feel chest pains until it's too late, and this is what we see. So our machines can identify this very early and ensure that you have a good quality of life.
Wonderful, Doctor. We can go on talking forever. Unfortunately, we are running out of time, and a message comes through saying, Salam's very interesting topic. I'm not able to take down the name of your guest. Please, can you give me the phone number and name? I'm driving, so I can't take it down. And I'm sure that listeners are eagerly awaiting to take down your contact details to contact your practice for an appointment at the Heart and Healthcare. So take it away, Doctor.
Well, before I mention that, I'd like to offer the mothers something because they're always working so hard. So what
Absolutely.
we want to do is that if you book for two patients, for a mother and child or mother and her husband, we will do the foot detox for free for the mom, and we will give 300 rands off the second test. So this will
Fantastic.
basically help her to ensure that she gets some benefits in.
I'm sure our urban women listeners will
We are
appreciate.
located in Broadway.
We're losing you.
Our
We're
phone
losing
number
you.
is 031. Okay, you got that now? We are
Yes.
located in Durban North in Broadway. Our
Mm-hmm.
contact number is 031 563 0419. 031 563-0419. We only take appointments. We don't take walk-in patients, unfortunately. So you'll have to book an appointment before coming to us.
Thank you so much. This has been so enlightening chatting with you, Doctor, and I think so beneficial because often we wonder what's going on with our kids, what's going on within ourselves, and we go and do all the various tests, and we go and take all the medication and the antibiotics, and as you said, then we got to run and get the probiotics, and we still don't know what's going on. So let's get that test done. Visit Dr. Rakesh Muhanlall. He is in Broadway in Durban North. That number again to contact him, 031-563-0419. Until we connect again with you, Doctor. Have yourself a lovely day and bye for now.
Thank you. The next time maybe we can discuss your mom and we'll speak about her problems.
Perfect. Look
Take
forward
care.
to it.
Thank you for having me on the show. Thanks to the listeners as well. Thank you. Bye.
Absolutely wonderful. And that was Dr. Rakesh Muhanlall chatting with us. So important for us to know. The doctor. Okay, so there's a comment coming through all around this.